Welcome back to the Motivated Mind Zone. Glad to have you here. Today we are jumping into, well, one of the most fascinating and frankly high-stakes topics we've tackled, how mental health gets shown and often twisted in the media we consume every day.
Yeah, everything from Hollywood blockbusters, those big games, right down to what you're seeing on TikTok.
Exactly. And Reddit, too. It's everywhere.
And this deep dive is really important because we're looking at sources from a top psychiatrist. Our mission here, to cut through the noise, those common myths.
We need to understand the difference, right, between what's just entertainment
What's an ethical discussion by professionals?
and what's, an actual diagnosis.
Precisely.
Because media's influence is just huge. It plants ideas. Remember the Karate Kid back in '84?
Oh, yeah, suddenly everyone wanted to be a martial artist.
Right. Or Jaws in '75.
Yeah.
That led to a spike in shark hunting because, well, the movie made them seem purely evil.
That's a powerful example. If a film can make people hunt sharks,
Imagine what happens when the ideas are about complex things like depression, anxiety, or trauma, especially when the portrayal is flawed.
exactly. So the goal today is making sure those ideas people get about mental health from media are, well, good ideas or real ideas.
Hmm.
We need clarity on where those ethical lines are.
Okay, let's dive right in. Starting with ethics. There's this fascinating boundary for doctors, isn't there, when they see public figures in the news?
Ah, you mean commenting publicly.
Yeah. What stops a psychiatrist from tweeting their opinion about, say, a politician's mental state or a reality TV star's behavior?
That's where the Goldwater Rule comes in. It's a really core principle in psychiatric ethics.
The Goldwater Rule.
Yep. It strictly prohibits psychiatrists from giving a professional opinion on public figures they haven't personally examined and gotten consent from to discuss.
Okay, where did that name come from?
Goldwater.
It goes back to 1964. Senator Barry Goldwater was running for president.
Uh-huh.
And this magazine, Fact Magazine, sent out a survey to thousands of psychiatrists asking if Goldwater was psychologically fit for office. Wow. And they responded.
Nearly 1,400 did, without ever meeting him, mind you. They offered all sorts of opinions, often contradictory about his fitness. It was published.
1,400. Diagnosing from afar, that sounds like a huge problem.
It was a total mess. Goldwater sued and won. The American Psychiatric Association realized this was damaging to the person and to the profession's credibility.
So the rule basically says, don't diagnose without the whole picture.
Exactly. You need the history, the context, a proper evaluation. It prevents doctors from just reacting to headlines or doing harm with incomplete information.
Which must feel like a real constraint now with everyone online playing armchair psychiatrist after seeing a 20-second clip.
It's the crucial guardrail. The doctor's role isn't public speculation. It's patient care and upholding standards, grounded in assessment, not opinion.
Okay, so that's for real people. But what about fictional characters? We all love diagnosing Darth Vader or Walter White. Do the same ethics apply there?
Oh, not at all. Fictional characters are actually fantastic teaching tools.
Teaching tools? How so?
They offer a kind of safe distance, an entrance, you could say, into talking about mental health issues that might feel really scary or stigmatizing otherwise.
So talking about Darth Vader having maybe borderline or histrionic traits or analyzing the Joker, that's not just nerdy fan stuff. It's useful.
Definitely useful.
Yeah.
It lets people explore complex psychological ideas at arm's length. You know, for a long time, comic creators especially sort of pushed back against that kind of analysis.
Really? What?
They felt it overcomplicated things, maybe took away from the story.
But that seems to be changing now. We hear about consultants being brought in on big projects like Batman Arkham Shadow, specifically for psychological depth.
Yes, and that push is a fantastic development.
Yeah.
When characters aren't just, one-note crazy villains, they become more relatable, less stigmatizing.
People see bits of themselves.
Exactly. Maybe they see their own struggles with control or a fear of abandonment or anxiety reflected, even in a superhero or villain. And that's a step towards self-understanding.
All right, let's give Hollywood a kind of report card then. Where does the media consistently get mental health wrong? What's the biggest recurring mistake?
I'd say the most consistent F grade, unfortunately, is blurring the line between psychopathy and psychosis.
Okay, that's a big one. Psychopathy versus psychosis.
Yeah.
Let's use the Joker as an example. He's maybe the ultimate villain. Clinically, what is he and what is he not?
Fundamentally, the Joker fits the mold of a psychopath. That describes a personality structure. Think callousness, zero empathy, manipulation, using people like objects, calculated.
Calculated. Okay, so what is he not?
He's not psychotic. Psychosis means a break from reality. Hallucinations, delusions, maybe disorganized thinking. Media often matches these together.
Implying that if someone's hallucinating, they're also a dangerous, manipulative criminal.
Precisely. And the harm there is huge.
How so?
It feeds that awful, damaging trope.
Yeah.
Mental illness equals dangerous criminal. The old narrative was often, oh, this character was neglected or has condition X, therefore they become a psychopath. We've heard people say these depictions actually scare them away from getting help.
Because they worry they'll be seen as a potential criminal.
Yeah. Makes me feel like I'm gonna be a criminal is something psychiatrists hear.
But thankfully, we're seeing more complexity now. Anti-heroes, even heroes who struggle. Tony Soprano having panic attacks.
Yes. Or Don Draper in Mad Men with his identity issues and trauma.
That nuance is so important, isn't it?
Absolutely vital. When you see relatable struggles in characters, even heroes, it clicks. Someone mentioned Superman, the burden he carries.
Right, feeling separate but responsible for everyone.
It mirrors real feelings people have, caring for parents, work stress, just the weight of life. It validates that.
Okay, let's talk therapy scenes. We see them all the time. Is therapy ever really like Good Will Hunting with those huge dramatic breakthroughs?
Well, overall, portrayals are getting better. Think The Sopranos, Dr. Melfi. That was pretty complex and respectful over time.
Right.
But drama always means sacrificing some realism. Those big movie climax moments, like in Good Will Hunting, where suddenly the core trauma unlocks. It rarely, if ever, happens like that in one explosive session.
And that specific scene, the one where Robin Williams grabs Matt Damon, that gets called out ethically, right? Even though it's powerful cinema.
Oh, absolutely. It's a perfect example for teaching about boundaries, what we call the frame.
The frame. We'll come back to that.
When he grabs him, physically confronts him, he completely shatters that frame. The sources highlighted he'd have needed to apologize next session, not just for the outburst, but for breaking that professional boundary.
And we see smaller frame breaks, too, even in shows praised for showing therapy, like Never Have I Ever. It was great seeing a teen get help, but...
Yes, positive representation there. But you still see unrealistic things, like the patient just busting into the office.
Yeah, or the therapist giving a hug.
Exactly. Those things might seem nice or caring on screen,
Yeah.
but professionally, they're risky because they muddy the waters, compromise the objectivity needed for therapy to work.
Okay, that leads us perfectly into the online world. TikTok, Reddit, they're flooded with self-diagnosis content. And the trend of diagnosing your ex. Why is that so rampant, and what are the risks?
Well, that urge to label a difficult psychopath or sociopath is super common online.
Right.
But usually what people are actually describing sounds more like extreme narcissism.
Ah, okay. So lack of empathy, being totally self-absorbed.
Thinking they deserve the best, no need for introspection, that kind of thing.
So it's using a dramatic label for maybe selfish or difficult behavior rather than a specific clinical diagnosis.
Exactly. Getting a formal diagnosis of narcissistic personality disorder, NPD, or antisocial personality disorder, ASPD, which is what people often mean by sociopathy or psychopathy, involves meeting very strict criteria. It's much more than just they were selfish.
And the risk with social media trends.
People come into a doctor's office already self-diagnosed, convinced they have ADHD and need stimulants, maybe, or using PTSD very loosely for any bad experience.
But the doctor needs more than a TikTok video, right? They need proof, history.
Absolutely. For ADHD, for example, you need objective evidence. Old school report cards showing attention patterns, maybe talking to family members, a thorough history, the guardrail for you, the listener scrolling through this stuff. Remember, you are a whole person. You're not the 2-minute clip you're watching.
You need individual care, not a trendy label.
Precisely.
Okay, let's circle back to the frame. We touched on it with Good Will Hunting. Can you define that again and really explain why it's so critical in actual therapy?
Right. The frame is basically the whole set of boundaries that keep the therapy space consistent and safe. Professional, ethical, time boundaries.
Like the session length, the cost, confidentiality.
Exactly. Physical distance, how communication happens outside sessions, all of it.
Why is keeping that so consistent and, well, rigid almost so important?
It's all about helping the patient maintain objectivity. It ensures the relationship stays purely therapeutic. It's not a friendship.
So if the therapist breaks that frame, like offering to grab coffee or sharing way too much about their own life.
Then the session risks becoming about the therapist, not the patient. It shifts the focus.
And psychodynamically, this relates to managing something called transference,
Okay,
right?
that's the really key psychological piece. Transference is when the patient unconsciously projects feelings and patterns from past important relationships, often with parents, onto the therapist.
Okay.
The consistent, predictable frame acts like a blank screen. Those old patterns get projected onto it, and then the therapist and patient can look at them together safely.
So if the therapist breaks the frame, gives an unexpected hug, brings a gift,
The patient might experience what's called a cognitive distortion. They
meaning,
might read special non-therapeutic meaning into it, like, oh, they hugged me, I must be their favorite patient, or they see me as special, maybe like a friend.
and that messes up the therapy.
Totally. It destroys that necessary objectivity, creates potential power issues, and can turn the process into something less helpful, maybe even an unhealthy dependence.
Got it. Okay, let's switch gears to treatment itself. When someone does seek help, what are the main types of therapy out there? What makes them different philosophically?
Okay, looking at the main evidence-based ones, first you have cognitive behavioral therapy, or CBT.
CBT, heard of it.
Its philosophy is basically that our feelings come from how we interpret situations. So it focuses on the present, uses tools like thought records to examine thinking patterns, and techniques like exposure response prevention, ERP, for fears and anxiety,
No.
changing thoughts and behaviors directly.
More structured, present focused. What else?
Then there's psychodynamic psychotherapy. This is more exploratory.
Deeper dive.
Yeah. The goal isn't just changing behavior, it's gaining insight. The idea is that current struggles, especially in relationships, often stem from unconscious patterns formed way back in childhood.
So it connects present issues to past experiences, like noticing dynamics with your spouse, echo dynamics with a parent.
Exactly. Seeking the root of the pattern.
Yeah.
It's less structured, more about exploring those connections over time.
Okay. And then there's one specifically for really intense emotional issues.
Right. That's dialectical behavioral therapy, or DBT. It has the most evidence for borderline personality disorder, BPD, or people with strong BPD traits.
What makes DBT different?
Its structure is very comprehensive. It's team-based care, usually group therapy and individual therapy, plus things like 24-hour phone coaching for crises. And it uses very specific techniques like chain analyses to map out exactly what led up to difficult behaviors or emotions.
We saw an amazing, if unsettling, portrayal of BPD traits recently. Jamie Lee Curtis in the Bear the Fishes episode.
Oh, that was an incredibly astute portrayal from a clinical standpoint, yeah.
Her character, Donna.
Shows classic BPD features. That unstable sense of self, the intense fear of abandonment leading to frantic reactions, the extreme emotional ups and downs. DBT is built to help manage that intensity through skills training and radical acceptance.
Let's talk medication quickly. That's often a scary topic for people starting out, partly because of media hype around side effects, right?
Absolutely, and transparency here is key. A good provider needs to be honest and say, look, we don't know exactly how these work on a super detailed level.
Really?
We know they affect brain systems involved in mood, like serotonin, dopamine, but the precise mechanism isn't always fully understood. That uncertainty, plus media focusing on worst-case side effects, naturally creates anxiety.
And media also sets up this other expectation sometimes. The idea that love or just finding the right person will cure mental illness, like in Silver Linings Playbook.
Yeah, that's a common and pretty damaging trope. Connection and love are vital for well-being, absolutely. but they aren't a cure for, say, a chemical imbalance or a personality disorder. They don't replace treatment.
So setting expectations realistically is crucial.
It is. That idea of a sudden Hollywood fix is just not reality.
So if cure isn't always the right word, what is the realistic goal of treatment?
Functionality, learning how to manage the illness, how to dial down the volume on it.
Nail down the volume. I like that.
So if you have BPD, the goal isn't necessarily to make the traits vanish forever, but to manage them so they don't disrupt your entire life, your job, your relationships. It's about moving forward with the issue, not needing it to be instantly erased.
Okay, zooming out then. A key takeaway for you listening seems to be mental health is a part of you, but it doesn't have to define you. But we have to be aware of how media shapes our thinking about it.
Definitely. And if you're thinking about seeking help, don't let all these terms overwhelm you. Start simple. Talk to your primary care doctor.
Good first step.
And crucially, figure out the practical side early. Insurance, copays, sliding scales, out-of-network options. Ask about the cost up front.
And based on everything we said about the therapeutic relationship, the frame, what's the most vital question to ask a potential therapist right at the beginning?
Always ask, is it possible to meet briefly first, just to see if it feels like a good fit? And do you charge for that initial chat?
Focusing on that initial connection.
Yeah, that's how you start building trust, even before the real work begins.
Okay, so considering that most psychological growth actually happens outside the therapist's office in daily life, here's a final thought for you to take away. What's one idea from our conversation today? Maybe understanding the Goldwater Rule or the importance of the frame or that distinction between psychopathy and psychosis. What's sticking with you right now? And how could you use that insight to bring a bit more psychological depth to your own life and relationships? Thanks for joining us for this deep dive. We'll catch you next time, getting straight to the insights that matter.